Okay, P and C, parietal lobe, parietal lobe, parietal lobe, and S, and S, and S, and S. We also have S. First is stereognosis. Stereognosis. Ano, alam niyo kung anong stereognosis sa ating health assessment dati? It's your awareness and of size and shape of object. Parang ito, nalalaman mo siya na parang 3D siya. Alam mo siya na feel mo siya kahit pipikit ka, alam mo na rectangle siya. That is stereognosis. Okay? That's stereognosis. The other one is proprioception. 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 Your body position. Basically, your body position. Okay? Your body position. Okay? And usually, ang involved dyan is right parietal lobe. Okay? Right parietal lobe. Okay? Right parietal lobe. And lastly, we have spatial perception. Spatial perception. Basically your relation, your ability to understand your body's position in relation to your environment. Ayun, kaya ang ating parietal lobe, okay, ang ating parietal lobe, P and C. P, T, 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 P. Tapos lagyan natin ng S, 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 P, S. Ganon, S, P, S. For pain, touch, taste, temperature, and pressure. And lastly, for stereognosis, ability to discriminate whether an object is 3D or not. Proprioception, okay, proprioception, your body position, and spatial perception, okay, your position in relation to environment, your place in your physical environment, okay, your understanding of that, okay, okay. Then next, madali lang to, occipital lobe, alam na alam niyo to, okay. Pag occipital lobe naman, pag occipital lobe, occipital lobe. Pag occipital lobe, visual center. Ating visual center. Visual center. Okay, 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 okay. Na kapag sisirain natin to, pag sisirain natin ang occipital lobe natin, sisirain natin ang ating visual center, it can cause alexia. Alexia or inability to understand. Okay, inability to read rather. Inability to read. Ayun lang si occipital lobe. Okay, our next one is the temporal lobe. Temporal lobe. Temporal lobe. Temporal lobe. Okay? Our temporal lobe is our auditory center. Our auditory center. They processes information. Ang pagkaintindi din natin, nandito din siya. Okay? Pagkaintindi natin ng things na narinig natin. Kaya nandito si Wernicke's area. Wernicke's area. Wernicke's area, which is responsible, again, take note, responsible Wernicke's area, understanding of language. Ha? Understanding of language. Broca's area, ability or production of speech. Production of speech, Wernicke, understanding of language. Na kapag sisirain natin to, kapag i-damage natin to, magkakaroon ng receptive aphasia. Okay? Receptive aphasia na although makakasalita ka kapag magsasalita ka sa patient na may receptive aphasia, hindi ka niya maiintindihan mga mi. Hindi ka niya maiintindihan. Kaya nga nasira. Kaya nga sabi natin, nasira si Wernicke's area because understanding of language, diba? So kapag sirain mo yan, X na yan, magkakaroon ng receptive aphasia. Hindi ka niya magigets. Okay? Hindi ka niya magigets. And kapag i-combine natin si receptive and Broca's aphasia, both unable to produce speech and unable to understand the language, we have what we call as the global aphasia. Okay, take note of that. Global aphasia. Okay, global aphasia. Okay, temporal lobe. That was na. And our last one is our limbic system. Limbic system. And it contains two things. Our first one is our hippocampus. Okay, hippocampus. A hippocampus. Hippocampus. Okay, take note natin na si hippocampus, they convert. Okay, kanina si parietal or si frontal lobe is for memory. Ang function ni hippocampus on the other hand is they convert short-term memory, short-term, 'di ba, mga days lang or probably mga ilang minutes to seconds lang. They convert it into intermediate and long-term memory. That's why if magme-memorize ka, for example, and na-convert ni hippocampus yung information na natutunan natin ngayon, kaya mo yung itap ang PNLE. Kaya mo yung mag-tap ng PNLE kasi na-convert na ni hippocampus into long-term memory. Long-term memory na. Conversion of short-term to intermediate to long-term memory. Ganun yan. And B is amygdala. That's why our limbic system is responsible as well for emotions. Amygdala. Tandaan natin si amygdala. Amygdala is emotions. Okay? Emotions and sex, roar, parang gano'n, gano'n. Emotions and sex, roar, parang gano'n. Emotions, angry ka na, nag-roar ka pa kasi may sex, gano'n, gano'n 'yan, gano'n, gano'n, okey, gano'n. Emotions and sex, okey, emotions and sex, okey? Okey, okey na ba sa ating mga lobes? Okey na ba? Okey na ba? Okey, okey na ba? Okey na? Okey, let's proceed. Let's proceed.
Wait lang guys, nawala ata si sir. Sorry. Okay, agawin ko ulit ang eksena guys I'll play ulit the video. We'll play ulit the video po. Yung kanina about ICP.
Opposite direction when the head is turned. This means that the brainstem is intact. If the eyes stay fixed, and if they're really blown or dilated when the head is turned, this means the brainstem is affected. Now, the other sign that we see is in the foot, the Babinski's reflex, where toes fan out when stimulated. This is bad. We want toes to curl down and not fan out. It could mean that the brainstem is being crushed, aka herniated. Now, this finding is normal in an infant below 1 year old, but not normal in an adult. Now, later signs we'll see a seizure and comas as the brain gets further squished, and then abnormal posturing, we get decorticate, where extremities go toward the core of the body, and decerebrate, which was mentioned by ATI. Now,
Screenshot muna guys na sa ating ICP na the late and deadly na mga signs po natin. Okay, we'll play ulit.
decerebrate is far worse. The arms kind of flex out toward the sides and become rigid and extended. So just think, you cannot celebrate with decerebrate. It's far worse. So a commonly missed NCLEX question talks about a priority assessment finding for a client recovering from a head trauma. Select all that apply. So option 1, eyes move in the opposite direction when the patient is turned. Yes, this is a good sign. The key term here is that the eyes move. This is doll's eyes. We do not want eyes to be fixed and dilated. That means the brainstem herniation. Now option 2, extremities are contracted toward the core of the body. No, this is a bad sign. That's decorticate. Any type of posturing is bad. Now, option 3, fixed pupils that remain 8 millimeters. That's the key term, 8 millimeters, and they're fixed when assessed with a pen light. Guys, that's really bad. Fixed dilated pupils means brainstem herniation. Now, option 4 and 5 are incorrect. So, level of consciousness that is not diminished since admission. This is a good sign. It means that the patient's not getting worse. And option 5, grips that are 5 by 5 bilateral. Yes, good strong grips are good. And then number 6, toes that fan out when the sole of the foot is stroked. Remember, that's very bad. This is Babinski's sign. We want those toes to curl. Now, one of the last signs to note is Cushing's triad. Huge NCLEX tip here, so pay attention here. Think Cushing's triad, we get Crushing's triad. Since the brainstem is being crushed by that ICP, we get a crushed heart rate and respiratory rate since that brainstem controls those. So we'll see widening pulse pressure with high BP, that hypertension, and low heart rate, that bradycardia, and very low respiratory rate, known as decreased respirations on many question banks. So for widening pulse pressure, this just means that the blood pressure numbers are getting further apart, very wide. So systolic blood pressure, that top number, is getting higher, and then the diastolic blood pressure the number on the bottom, is getting lower, as well as the heart rate too. So let the name help you here. The blood pressure ends up wide apart with this widening pulse pressure. So again, Cushing's triad, just think Cushing's triad. Crushed heart rate and respiratory rate with a wide blood pressure. As far as diagnostics, the imaging CT scan is the first test we do to get a quick, easy picture of the brain and to show the root cause of this increased ICP. Now, don't get tricked. It's not an MRI. Those are typically long and slow. So the memory trick we use is think CT scan, that CAT scan, is like cat-like reflexes, a very fast reading. And then secondly, no lumbar puncture, aka spinal tap. This can actually cause worsening ICP. And for long-term patients, we do ICP monitoring with a subarachnoid screw, also known as a brain drain. Now, normal ICP is between 5 to 15. So anything above 15 means that increased ICP is getting worse. Now, the good news of this brain drain is that we get very accurate readings, but the bad news is the high risk for infection, like really high. So that's why we only use it for very serious long-term patients like those in a coma. Now, a tricky NCLEX question is about a client found on the floor appearing lethargic with bleeding to the back of the head and a heart rate of 45 and a blood pressure that's pretty high. What is the first action? So the answer is to immediately do C-spine immobilization and then do a CAT scan, that CT scan, to rule out intercranial bleeding. Now, these kind of questions are very tricky, right? But on the NCLEX and your nursing exams, always remember assessment comes before intervention. So for this low heart rate and high BP, don't let the NCLEX trick you here. Yes, the blood pressure is high and you're probably thinking you have to give meds to lower it, right? But we must prioritize this brain bleed here, since that will kill the patient the fastest. And this is an assessment finding. So we need a STAT CT, that picture of the brain, and not drugs first. Now for nursing interventions, to keep it really simple, use the memory trick ICPs. I for immobilize the head in C-spine. Some question banks said head in neutral position and log roll the patient as one unit. C is for CO2 that is low. Remember, lower CO2 means lower ICP, below that 35. Since carbon dioxide vasodilates the brain, resulting in more swelling from more blood flow. So typically, patients on ventilators, we hyperventilate these patients to blow off CO2 and lower ICP. So Hesse had a question about this, stating that a client on a ventilator with increased PaCO2, the nurse receives an order to increase the respiratory rate on the ventilator. This change should have what expected result on the patient's ICP? And the answer was decreased ICP because we have decreased carbon dioxide. Now, in terms of positioning, we need to make sure the head of the bed is in semi-Fowler's position, 30 to 35 degrees or even higher here. This promotes drainage. And no flexion or bending of the extremities. So remember, this is a no flex zone here. No ninja moves, no hidden dragon, no matrix type of stuff. And lastly, no coughing, no sneezing, or even blowing the nose. And definitely, key term here, no Valsalva maneuvers like holding the breath.
Okay, screenshot again. Connecting pa si sir. Yan, screenshot muna guys. Thank you so much.
Or bearing down to use the restroom. This adds more pressure, making the ICP even worse. Now, Kaplan mentions that instructing a patient to exhale when turning or moving in bed. Remember, no holding the breath, exhaling. So holding the breath could lead to that increased abdominal pressure, which will increase pressure inside the brain. And a common NCLEX question talks about immediate intervention when a client with ICP states, I will turn, cough, and deep breathe. No, we want to avoid all of these things. The key term here is no coughing. And lastly, S is for suctioning. Key term is 10 seconds or less and limit suctioning as much as possible. And always before and after suctioning, we use 100% oxygen. Now, Hesse touched on all of these in a SATA question, stating interventions for increased ICP. So, the correct answer was position, that is semi-Fowler's, place the neck in neutral position, teach the patient to avoid Valsalva maneuvers, position the patient by avoiding flexion of the hips, waist, or
Hello, sir.
neck.
Hello,
Key term
everyone.
there is flexion.
Hi, sir.
Pwede hindi muna ako mag-on cam, sir.
Sige, sir. No problem, sir.
Kasi hindi ko pa ma-connect yung yung Mac, yung laptop.
Okay, sir. Sige.
Okay, para nagde-data na lang ako kasi nakakainis yung wifi.
Sige lang, sir.
Nakakainis. Nadi-disconnect.
Sige
Naman
lang, sir.
ganun. Naman ganun. Okay, tara. Tara. Let us share screen. Ayan guys, sorry talaga. Sorry.
Sir
Okay.
Vince. Sorry. Sir Vince, may mga nagtatanong, sir, can they avail ba yung yung shinare mo ata during your vlog ata yung what do you call that? Yung sa parang the Anki, Anki ba yun?
Yung Anki po, sir.
Yes, sir. Paano daw sila
Yes po, pwede po. Isisend ko dito yung yung link po.
Sige, sir. Thank you so much. Thank you.
Okay po. Okay. So, ayan. Ayan, sorry talaga guys. Sorry. Ayan, nag-data na tayo para hindi na tayo mawawalan ng connection. Data na tayo. Okay, tara. Tara, let's go. Okay, kita nyo ba? Ayan, kita nyo ba?
Yes, sir.
Ayan po. Okay, let's go. Okay, for cerebellum. Asan tayo kanina? Asan tayo sa cerebellum, di ba? Okay. Sa cerebellum, sabi nga kanina, di ba? Kapag sa kay cerebrum, ang contralateral. Kay cerebellum naman, ipsilateral ang control. Okay, ipsilateral. Ang balance natin and coordination is ipsilateral. Same side of the brain or same side of cerebellum, same side din ng katawan. Okay? Ipsilateral. Okay? The next is our diencephalon. Diencephalon. Ayan yung mga amos. Okay? Diencephalon. Yan yung mga amos. Okay? Amos, epithalamus. Our first one is epithalamus. Okay? Epithalamus, they secrete melatonin. Okay? Secretes melatonin. Okay? Yan lang tandaan nyo kay epithalamus. Secrete melatonin. And we know that melatonin is responsible for regulating sleep. Okay? Regulating sleep. No, si thalamus naman. Thalamus. Okay? They relay sensory information to the cortex. Sensory information to cortex. Okay? They relay sensory information to cortex. Ganun lang yun. Okay? And letter C is hypothalamus. Okay? Hypothalamus. Okay? Hypothalamus. They are the master of pituitary gland. Okay? Pituitary gland. Okay? They are the master of pituitary gland. Bakit? They release certain factors that inhibit or stimulate the pituitary gland to release hormones. Okay? They are the master of pituitary gland. Again, hypothalamus, master of our pituitary gland. And also, they regulate our autonomic nervous system and in essence, they regulate the responses of our SNS and PNS. Ganun lang yan. Okay? They regulate the responses of PNS and SNS. Okay? Besides being the master of pituitary gland, they regulate our autonomic nervous system, the responses of SNS and PNS. Okay? SNS and PNS. Our next one is our brainstem. Okay? Our brainstem. Okay? Brainstem. Our next one is our brainstem. The first part, it is divided into three parts. Okay? It is divided into three parts. Our first one is our midbrain. Midbrain. And midbrain is responsible for our postural reflex. It is a reflex maintaining balance. Okay, automatic control of posture, balance, and coordination. It is a reflex for posture, balance, and coordination. That's why we can stand upright because of midbrain. Okay, midbrain. Kahit almost ka na matutumba, di ba? There's a reflex to maintain your upright position because of what we call as the midbrain. Okay? Besides that, it integrates the following. First one is visual information or visual reflex. Example, kapag nakakakita ka ng bee, di ba? Nakakakita ka ng bee, you duck. Okay, you duck when you see a bee, di ba? Kapag nakakakita ka ng bee, wasp, mga ganyan, you duck, you see it, you duck because it's a reflex. And the part of the brain that integrates this one is our midbrain. Okay, our midbrain. The second one is our auditory reflex. Example of this, a great example of this is kapag may nag-hear ka or may narinig ka nag-honk or nagbusina, may bumusina, you turn your head. Okay? The processing of these things, the visual auditory reflex is integrated in the midbrain. And other than that, it is also involved also is our postural reflex. Okay, postural reflex. Okay, our next one is our pons. Okay? Pons. And it controls the rhythm of breathing. Okay, tandaan nyo yan. Yan lang yon. Rhythm of breathing. Okay? Rhythm of breathing through two parts. We have the pons have two parts. The apneistic center, and also the pneumotaxic center. Pneumotaxic center. Okay? Pneumotaxic center. The apneistic center prolongs inhalation. The pneumotaxic center, on the other hand, they contribute to exhalation. Okay? Okay? Apneistic center prolongs inhalation. Pneumotaxic center contributes to exhalation. So yun lang. And through these two processes, to these two centers, we can regulate the rhythm of breathing. Okay? Rhythm of breathing. Okay? Rhythm of breathing. Okay, our next part is our pons. Ay, tapos ng pons, diba? Our next part is our medulla oblongata. Ayan, medulla oblongata. Medulla oblongata. And this is a reflex center for our coughing, sneezing, swallowing, vomiting. Ayan, this is our reflex or the area of the brain responsible for our reflex center for coughing, sneezing, swallowing, and vomiting. Okay, swallowing and vomiting, and it also regulates our cardiorespiratory regulation. How? Okay, cardiorespiratory regulation. It increases or it regulates the HR or our heart rate. It also regulates our BP, and it also regulates our respiratory rate. Ayan, ang regulation or cardiorespiratory regulation of our HR, BP, and RR is our medulla oblongata. Imagine if masisira to, di ba? Alam niyo na kung anong mangyayari. Mawawala yung mga reflex na to and mawawala ang regulation for these things. Okay, for the HR, heart rate, blood pressure, and respiratory rate. And lastly, for our brain, last part of our brain na important is reticular activating system. Okay? Reticular activating system. And they control the sleep-wake cycle. Okay? Yan, sa circadian rhythm natin. Diyan involve ang ating circadian rhythm. Reticular activating system. And it controls our sleep-wake cycles. Okay? Sleep-wake cycles. Okay? Let's proceed with our spine. Okay, tapos na tayo sa ating brain. Medyo mabilis, no? Okay, onting intro lang naman kasi to. Okay, hindi pa tayo sa important na parts na usually na lumalabas sa ating board exam. Ayan, let's copy paste from the internet ang ano. Picture ng spinal column. Wait lang. Ang nag-loading pa. Ayun. Picture ng ating spinal column. Ayan. Ano na ba? Ayan. Ayan lang. Ayan. Ayan, that is our spinal column, di ba? That is our spinal column. Narinig nyo ba? Ayan, ayan, spinal column, spinal column. And we have, five different parts, okay? Five major parts of our spinal column, okay? Our spine. Okay, what does our vertebral column do? Vertebral column basically protect the spine. And this spine protects spine. And this spine carries nerve signals between the brain and body. Sila 'di ba? Part ng ating CNS pa rin, CNS pa rin. And they carry this transmit these impulses between our brain and our body. So anong important na kailangan yung malaman sa ating spinal column? Our first part of our spinal column is we have cervical. And cervical spinal column includes seven. Para matandaan nyo, C7. Okay? 7. Parang ganyan. 7. Parang ganyan. C7. Okay? C7. And sa cervical spinal column, we have an important spinal column na usually naapektuhan sa mga traumatic spinal cord injury. Ito ang ating C3 and ating C5, okay? Which involves our phrenic nerve. Imagine kapag sisirain natin ito, okay? Di ba? Phrenic nerve innervates the diaphragm. Okay, imagine, and we know that diaphragm is mainly involved besides our intercostal muscles, our diaphragm is involved as well in breathing. Okay? In breathing. So, sirain na natin to. Okay? Sirain na natin ito. Okay? Dito natin sirain pala. Okay, sirain natin to. Okay? Sirain natin to. So, anong maglilid? Respiratory arrest. Ganun lang yan. Respiratory arrest. Ganun lang yan. Okay, ganun lang yan. Okay, kapag sisirain natin sa C3 and C5, kapag may spinal cord injury, 7, ayan, 7, C3 to C5, magkakaroon ng respiratory arrest because it innervates our diaphragm. So, what is our nursing intervention? Protect with cervical collar. Okay? Cervical collar. Tandaan nyo yun. Cervical collar. Okay? That is for our cervical. Next is thoracic. 12. Okay? Thoracic 12. Para matandaan nyo, thoracic is 12. Okay? 12. TT. Okay? TT. Thoracic 12. TT. Okay? Ang main responsibility ng ating thoracic spinal column or vertebral column is for attachment of ribs. Ribs, which is responsible to protect the heart and lungs. Okay? Responsible to protect the heart and lungs. Ayun, ganun yan. Yun lang ang tandaan kay thoracic. Okay, next is our lumbar. Okay, lumbar. 5, 5. 5. Okay, 5. Okay, 5. Ganun lang yan. Ganun. 5. Okay, 5. Okay, wait.
Recording in progress.
Wait lang. Ayan, lipat mo tayo. Wait. Hey, wait lang. Ang internet ko kasi ba't ko kayo iniwan? Ba't ko kayo iniwan? My God, wait lang talaga. Lumipat lang ako sa ano, wait lang. 29662. Sorry guys. Ay, sorry talaga. Okay, hindi na tayo magbe-break. Dire-diretso na to. Dire-diretso na to. Tatapusin ko talaga para pambawi sa inyo. Tatapusin ko na lang. Tatapusin ko. Tatapusin ko lahat ng apat na foundation na usually lumalabas sa board exam. Ayun. Ayan, tara. Tara. Rekta. Ready na. Ready. Okay, ready na ba guys? Ready. Ready. I'm back. Parang ganun. Parang ganun yan. I'm back. I'm back. I'm back, everyone. I'm back. I'm back. Ayan. Okay, let's proceed. Let's proceed sa ating lumbar, di ba? Lumbar 5. Ganun lang yan. Lumbar 5. And anong important natin tandaan kay lumbar area? Lumbar, that is the site of lumbar top. Okay? Site of lumbar top. Okay? Site of lumbar top. Okay? Between L3 to L5. Tandaan niyo yan side of lumbar top is between L3 to L5 because kapag above L2, this is the caudal end of the spinal cord or the tail of the spinal cord. And kapag nag-i-inject ka dyan or maglo-lumbar tap ka dyan, maglo-lumbar tap ka dyan, it can cause paralysis. Paralysis, ganun yan. Okay, it can cause paralysis. That's why our lumbar tap is between L3 and L5. Kasi kapag above L2, it can cause paralysis because that is the caudal end of our spinal cord. 'Di ba? Ang discussion natin dito is spinal column, okay, which protects the spinal cord. Okay, that is the end of our spinal cord. And lastly, second to the last, rather, is sacrum. Okay? Sacrum. Okay? Lima din yan. Lima din. Para matandaan nyo yan, ano? Para matandaan nyo, sacrum, 5, para 5, ganun, 5, sacrum, 5, 5. Okay, 5. Okay, sacrum is responsible for bowel and bladder control. Okay? Bowel and bladder control. Bowel and bladder control. 5. 5. 5. Ayun. 5 kasi 5. Ganun. 5. 5. And lastly, we have coccyx. Coccyx. Okay? These are four fused bones. Yun lang need nyo tandaan ha. Yun lang need nyo tandaan sa ating spinal column. We have cervical 7. Ayan, 7. Ganun. 7. Ayun, baka malilito kayo ha. Baka malilito kayo. Wag 5. Wag, ayun, 5. Ayun, 5 nga. Okay. 7. Cervical. Thoracic, 12. Thoracic, 12. Okay. Lumbar, 5. Okay. Lumbar, 5. Lumbar 5. Okay, lumbar 5. And sacrum 5. Ayun, 5. 5. Sacrum 5. Number 5, parang ganun. Number 5, 5. Okay, and coccyx 4 fused bones. And let's proceed to our ANS or autonomic nervous system. Autonomic nervous system. Excited ba kayo? Paborito nyo ba yan? Okay, paborito nyo ba yan? Part ba yan ng pharma nyo? Di ba? Nadaanan nyo ba yan sa pharma? Nadaanan nyo ba yan sa pharma ang ating autonomic nervous system? Autonomic nervous system. Nervous system. Okay, okay. Kumusta? Kumusta? Mahirap ba ang ANS or autonomic nervous system? Mahirap ba? I need chats. I need chats. Ano masasabi nyo? Okay, mahirap ba? Mahirap ba? Mahirap ba? Mahirap ba? Mahirap. Mahirap. Um, Okay, let's proceed. Okay, let's proceed. First one, okay, need nyo tandaan with our autonomic nervous system, di ba? We have the PNS or parasympathetic nervous system and sympathetic nervous system, di ba? Divided into two. Okay, divided into two. Then, next, di ba? Autonomic. Autonomic NS, okay? Autonomic nervous system. Autonomic nervous system. Divided by 2, magiging PNS, NS, and S. Ano need nyo tandaan? Okay? Ano need nyo tandaan? Kapag papaandarin natin si PNS, anong tawag natin dyan? Ano tawag natin dyan? Kapag we stimulate, okay, with drugs, or for example, or kapag na-stimulate na rin si parasympathetic nervous system, ano tawag natin dyan? Or when we use pharmacology for that, pharmacologic interventions, we call it as cholinergic agonism or cholinergic agonist. Example ng mga cholinergic agonist natin. Example, mga stigmins, okay? Stigmins, pilocarpine, okay? Pilocarpine, carbachol, mga ganon. Stigmin, pyridostigmin, physostigmin. Okay, mga ganon. Importante sa GBS natin, di ba? Importante sa GBS natin yung mga yan. Okay, cholinergic agonism or cholinergic agonist. Tandaan natin dry. Dry, anong dry? Wet. Wet pala, wet. Wet, okay? Pag si cholinergic agonist, wet. Okay, wet. And tandaan natin, dito sa wet na to, para tae, para tae, para tae kasi nagkakos ng diarrhea. Diarrhea, kapag ma-stimulate ang cholinergic agonism, para ihi, it simulates our muscle sa ating bladder muscle, kaya naiihi, and lastly is paradura, okay? Salivation, paladura, okay? Paladura, okay? Para tae, diarrhea, para ihi, kaya para, di ba? Ayun, parasympathetic, para tae, para ihi, paradura, salivation, diarrhea, and diuresis, polyuria, ano tayo, diabetes, ayun, para ihi, para tae, para dura, ganun yun, pag si cholinergic agonists, let's switch it up, ipapag-green natin tong iba, okay, kapag i-off naman, we have cholinergic antagonism, or we can simply call it anticholinergics sa pharmacology. Anticholinergics, tandaan nyo to kasi ANS pharmacology na rin to. Cholinergics, anticholinergics. Okay? And tandaan natin sa anticholinergics is dry, which I will explain later kasi almost same lang sila. Ang affectation na kapag papaandarin natin si sympathetic nervous system, kapag i-off natin si parasympathetic nervous system, same lang na anticholinergic yung effect. Almost the same. Not exactly lahat para parehas, pero we wanna simplify things kasi nagre-review kayo, di ba? Kulang na sa time. We don't have to know everything sa mga affectation kasi sobrang dami yan eh. Every organ ng body natin affected yan. So, ayan, isi-simplify natin, okay? Sabi natin, same lang na kapag i-on natin si SNS and i-off natin si PNS, same lang, okay? Same lang sila ng effects. Okay, we on this adrenergic agonism. Adrenergic agonist. Okay? Again, example pala ng anticholinergic drugs, we have atropine. Okay, atropine is a great example of that. We have SNS as well. Kapag i-off natin, same lang sila ng parasympathetic, okay? Ng parasympathetic nervous system kapag ipapa-under natin. Okay? Antagonist. Adrenergic antagonism. Okay? Rest. Rest, 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 rest. Ayan, rest and digest. Dito, fight, 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 fight. Okay, fight, Fine. Sabi nga natin same sila, 'di ba? Same. Ayan, same sila. So ayan, ang discussion natin ngayon ay same din silang lahat. Okay, same sila. Same sila. Pag i-off natin si parasympathetic, same ang effect kay sympathetic kapag i-on natin si sympathetic. Kaya tandaan natin na mnemonic, tandaan natin asa, anticholinergic, sympathetic, sympathetic, and adrenergic. Tandaan natin, anticholinergic, sympathetic, and adrenergic. Anticholinergic, sympathetic, and adrenergic. Ganun lang yan. Ganun lang yan. And bakit dry? Bakit dry? Kasi ang effects niya, kung kanina, di ba, para tae, para sympathetic tae, para sympathetic para ihi, para sympathetic para dura, dito naman dry kasi di makatae, di tae, okay, di makatae, di makaihi, and di makadura. Dura. Okay, ganun yun. Kabaliktaran lang. Constipation. Urinary retention and dry saliva. No salivation. No salivation. Okay, alalahanin natin yan ha. D. Big G. Ang ating Big G. Big G. Ganyan. Big G. Di makatae. Di makaihi. Di makadura. C. Anticholinergic, sympathetic, and adrenergic. Same lang yan. Okay? Not same, pero almost the same. Parang ganun. Since we cannot generalize, pero almost the same. It's just simplified. Okay, besides that, bakit Z? Kasi it dilates. It dilates our pupils. Okay, it causes pupillary dilation. Okay, pupillary dilation, mga mi. Pupillary dilation and bronchial. Sabi natin, smooth muscle, di ba? Part ng SNS. Okay, part ng ANS rather. Smooth muscles natin. GI tract, bronchus. Okay, pupillary dilation and bronchial dilation. That's why ginagamit sa adrenergic kapag nag-aasma, di ba? Nag-aasma, beta-2 agonism, mga albuterol natin, albuterol, ganon, salmeterol, ganon. And that's why ginagamit din sa ating mga examples ng asthma drugs na ginagamit we have ano mo terbutalin ba? Hindi terbutalin. Nalimutan ko na kasi last time na nag-discuss ako sa respiratory matagal na. Okay, nalimutan ko. Anong example na? Ipratropium, tiotropium, ganon. Ipratropium, tiotropium, anticholinergics for asthma because they dilate the pupils and the bronchus. Okay, they dilate the bronchioles. Okay, so atropine nagkakos ng pupillary dilation. That's why contraindicated siya, di ba? Contraindicated siya sa glaucoma kasi once na dilated ang pupil, hindi magkakaroon ng outflow of the aqueous humor. That's why contraindicated ang mga drugs na to. Contraindicated ang mga anticholinergics such as atropine with our glaucoma. Ganun yan. Dami-dami kong satsat, di ba? Dami-dami kong sinasabi. Okay? Dami-dami kong sinasabi. Dati, bronchial dilation because of beta-1 stimulation. Okay, beta-1 stimulation. Ganun, mali pagsulat ko ng beta. Beta-1 stimulation causes bronchial dilation. Beta-1 stimulation. Okay, kapag beta-2 naman, beta-2 stimulation leads to increased HR and increased cardiac contractility. Okay, increased HR and increased cardiac contractility. Para matandaan niyo yan, 1. Alam, baliskad. Ayun. Ayan, beta-2. Okay, baliskad. Para matandaan niyo yan, 2 kasi dalawa ang lungs. Okay? Ay, yes po. Pwede po mag-screenshot. Tara mga mi. Pwede mag-screenshot. Okay? Let's go. Okay? 2, beta-2 kasi dalawa yung lungs, di ba? 1, 2, left and right side, kaya beta-2. Isa lang yung heart, mga mi. Isa lang yung heart, 1, beta-1. And another effect of this because of alpha-1 stimulation, we cause vasoconstriction. Thereby, thereby increasing RBP. Increasing RBP. Again, through alpha-1 stimulation causes vasoconstriction, thereby increasing RBP. And what's involved in agonism, adrenergic antagonism, rather adrenergic antagonism is our alpha-2. Alpha-2 when we stimulate alpha-2. Usually yung mga drugs na involved dyan, when we stimulate alpha-2, we can have adrenergic antagonism because take note, sa ating adrenergic pharmacology or autonomic pharmacology, alpha-2 is the negative feedback receptor of our SNS. Again, negative feedback receptor for SNS and adrenergic agonists. For example, beta blockers, alpha blockers, mga olol, mga ganon, olol. Example nun, mga example nun. So, ayan, tandaan nyo, ang need nyo tandaan dyan, more importantly, is ang asa na to, okay? When we turn off the PNS, anticholinergic, when we turn on the SNS, adrenergic antagonism, and same sila, adrenergic or anticholinergic, sympathetic, and anticholinergic. Same sila ng effects, dry, hindi makatae, hindi makaihi, hindi makadura, dilates our pupil, bronchial dilation through beta-2 stimulation. Beta-1 stimulation leads to increased HR and increase constriction or contraction, cardiac contractility. And lastly, when we stimulate our alpha-1, it causes vasoconstriction, thereby increasing RBP. Now, I wanna ask you guys, magbibigay ako ng signs and symptoms, and you have to determine if anticholinergic rather, anticholinergic, cholinergic, ang labo ko kausap, no? Okay, i-identify na lang natin if cholinergic agonism or anticholinergic. Parang ganon. Okay? Parang ganon. Ang labo ko kausap. Okay, ang labo ko kausap. Okay, ang labo ko kausap, mga mi. Ganito na lang. PNS or SNS stimulation na lang. PNS or SNS stimulation. Okay? PNS or SNS stimulation. Okay? PNS or SNS stimulation. Okay? PNS or SNS lang isagot natin. Our first one is pupillary constriction. Pupillary constriction. PNS or SNS? Pupillary constriction. Constriction. Yes, PNS, di ba? PNS. Kasi sa SNS, sabi natin, stimulation of PSNS leads to dilation of the pupils. And kabaliktaran nun is PNS stimulation, constriction of the pupils. Bronchoconstriction. No, bronchoconstriction. PNS, SNS. PNS, SNS, mga mi. PNS. Yes, very good. Bronchoconstriction. Kasi kabaliktaran nun, SNS stimulation dilates our airway or bronchos through beta-2 stimulation. Beta-2 stimulation. Ganan. Decrease aqueous humor outflow. Okay? Decrease aqueous humor outflow. Okay? Decrease aqueous humor outflow. Okay? Decrease aqueous humor outflow. Outflow from our eye. SNS, yes, very good. SNS, okay? Most especially sa ating anticholinergics, kaya bawal siya sa ating glaucoma. Kaya ang ginagamit usually na medication sa ating glaucoma, pilocarpine, for example, gamit ganyan. Pilocarpine, mga timolol, ganun, timolol, pilocarpine, timolol, reverse lang yun ng effect niya. Constipation, mga mi, constipation. Consumption. Yes, SNS, di makatae. Diuresis, naiihi si lola mo. PNS. Okay, tearing, excessive tearing. PNS, very good. Dry vagina. Very good, guys. Ang gagaling. Magtatap ata. Oh my God, let's go. Very good. Ang galing nyo. Ang dali-dali nyo natututandaan nyo lang yung asa. Mga mi. Asa. And i-memorize nyo lang yung mga drugs na involved there. Ganon yan. Ganon. Okay, let's go. Dito beta blockers, mga ganyan, di ba? Okay, let's go. mami. Let's go sa ating cranial nerves. Okay? Cranial nerves. Masaya to, masaya. Cranial nerves. Cranial nerves. Okay. Bakit ganyan talaga? Handwriting ko talaga yung problema. Nakakainis. Nanggigigil ako. Ang pangit-pangit. Ang pangit-pangit, mami. Ang pangit-pangit. Okay, our first cranial nerve. Di ba? Tandaan niyo yan. Tandaan niyo yan ng first year natin. Paano natin memorize ang cranial nerves natin? O, O, O. To touch and feel. Very good. Anong V? Very good V at home. Parang ganun, di ba? Yun yung pag-memorize ko. Depende na yan sa inyo kung paano nyo gusto i-memorize. Para sa akin talaga, O, 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 to touch and feel very good vaginas at home. Parang ganon. Parang ganon. Ang laswa, ang bastos. Pero mas mabilis ka kasi makaka-memorize if funny eh. If funny ang minimemorize natin. Ayun, O, 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 to touch and feel very good vaginas at home. Parang ganon. Okay, start tayo sa O. O, 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 O. Okay, ang ating first one is O. Okay, first one, olfactory, 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 and important and ang function ng olfactory nerve natin is sensory function through smelling. Ew sa vagina. Yes, ew daw sa vagina. Same, sir. Same vibes tayo, sir. Same, same. Then, when we damage this, kapag sisirain natin si olfactory nerve, it can cause what we call as anosmia. Ayan. Anosmia, you can't smell. You can't smell mga ayan. Olfactory nerve smelling. When we damage this, can causes anosmia. Second one is optic sensory vision. Okay, ganun lang yan. Sensory vision. Okay, sensory vision. Number 3 is our oculomotor. Sensory. No, motor. Oculomotor nga. Motor, di ba? Movement of eye muscles. Movement of eye muscles. Ang 4 na eye muscles natin kasi may exception tayo later, di ba? We have 6 eye muscles, mga rectus, lateral rectus, mga medial rectus. Hindi ko na naiintindihan, nalimutan ko na nung first year na anatomy and physiology na yan. Pero yung i-need ko lang i-mention is yung exception doon na dalawa. Yung hindi kontrolado, hindi kontrolado ni oculomotor. Okay, oculomotor, movement of eye muscles, and constriction of pupils. Okay? Include na rin natin yung constriction of pupils. You stimulate this, you constrict the pupil, you dilate the pupil. Nandito siya kay oculomotor. Okay? Oculomotor constriction of pupils. Oculomotor constriction of pupils. The next one is our trochlear. Trochlear, same din, motor. Pero kanina, movement of eye muscles, 4 eye muscles. This one, kay trochlear, is movement of eye muscles inward and downward. Parang ganun. Inward and downward. Take note, inward and downward muscle for the eye is our superior oblique muscle. Okay? Movement of eye in and down. Okay? Our superior oblique muscles. Our superior oblique muscle. Ganun yan. Ganun. And our fifth one, okay? Our fifth one is our trigeminal nerve. Okay? Medyo mahaba-haba to na discussion kasi may disease tayo dito na i-discuss na. Trigeminal nerve. It is mixed. Okay? Hindi lang siya motor, hindi lang siya sensory. Mixed siya. Both sila. Okay? Our motor function for this. Our motor is mastication. Kakain ka. Ngunguya. Nga pag ngunguya ka, mastication. Si trigeminal nerve yan. Our sensory is corneal sensation. Sensory is our corneal sensation. Ala, pangit. My God. Sensation. Ayan. Corneal sensation. Sorry talaga, guys. Sorry, binibilisan ko kasi. Okay, corneal sensation. Para madami tayong madadiscuss yung practice questions so tayo eh. Okay, corneal sensation. Okay, no, kapag sisirain natin si trigeminal nerve, magkakaroon tayo ng tinatawag natin na trigeminal neuralgia, our first disease condition. for our neuro. Okay, 5 pala, 6, 6. Okay, trigeminal neuralgia. Trigeminal neuralgia. Anong need nyo tandaan dito, mga mi? Anong need nyo tandaan? Cause. Our first one is our cause. Ang usual na cause is compression of CN5. Ganun lang yun. Compression of CN5 or trigeminal nerve. Compression of CN5. Ganun lang yan. Compression of CN5. Probably through tumor, compress tumor, probably through head injury. Pwede din increase intracranial pressure, pero usually tumor Tumor trigeminal neuralgia. Unknown cause. Parang ganun. Okay, signs and symptoms natin. Signs and symptoms natin. Signs and symptoms, tandaan nyo to. Classic to. Classic signs and symptoms ng trigeminal neuralgia. Sudden, electric, shock-like, shock-like pain, ganon. Sudden, electric, shock-like pain in face. Most importantly sa ating lips, gums, nose, and cheeks. Lips, gums, nose, and cheeks. Sudden, electric, shock-like pain. Sudden, electric, shock-like pain. Again, sudden, electric, shock-like pain, trigeminal neuralgia. Okay, take notes, take notes, take notes. Sudden, electric, shock-like pain in the face, trigeminal neuralgia. Now, what is our management? Medical muna tayo. Medical kasi med-surg nga, di ba? Medical management, medical. We have carbamazepine. Carbamazepine by delaying transmission of pain. Sa ating seizure disorder, magdi-discuss tayo about carbamazepine later. Delayed transmission of pain. Ganun yan. Delay transmission of pain, carbamazepine. Now sa surgical management. First one, we have alcohol injection of the nerves. Bakit? Ang weird, no? Alcohol injection of nerves. Bakit? Ang reason daw is it blocks the nerves. It blocks transmission of the nerves, thus decreasing pain transmission. And ang ina-inject dito ang ating cranial nerve 5. Okay, ang ating trigeminal nerve. Alcohol injection of these nerves, and it blocks the transmission of pain. It acts. And lastly is neurectomy, removal para matanggal na yung pain kasi masakit talaga to. Mami. Masakit talaga to. Trigeminal yung masakit to. So isa sa mga palliative surgery na ginagamit na natin is neurectomy. Okay? Neurectomy. Para hindi na sumasakit para sa pasyente. Para hindi na siya masakit. Ganoon. Sa nursing management naman natin, ayan, ito mga need natin ituro. Ito yung mga need nyo tandaan. Ito yung mga need nyo tandaan, ha? Ito yung mga need nyo tandaan. First one is to avoid hot and cold foods. Okay? Foods kasi this can trigger pain. Itong mga to. Okay? Basically, our general principle, we have to put general principle para mas easier sa inyo. Matandaan yung nursing management is to avoid trigger of pain. Ayan, we have to avoid any triggers of pain. Anything that can trigger pain, avoid. Ekis yan. Ekis. Okay? First one is avoid hot and cold foods. Ekis. Next is avoid washing face, especially sa gripo. Avoid washing face. Okay? This can trigger pain as well. Okay? This can trigger pain. And the next one, avoid wind or gust of wind in face. Okay? Gust of wind in face. We have to avoid that. Okay? We have to avoid that. And now, what would be our diet? Our diet, since nahihirapan silang kumain dahil masakit and pwede makatrigger sa kanila if they chew on something, if they eat something special, touch yung lips, ganyan. Our diet should be liquid and soft. Ganon. Liquid and soft. And how do we chew food? We have to teach a patient to chew food on unaffected side. Kasi it might trigger na din It might trigger ulit when you chew on the affected side Might trigger. And very painful. Okay, so we have to chew on unaffected side. Again, chew on unaffected side. Ayun, ganun lang yung trigeminal neuralgia natin. Avoid hot and cold foods, avoid washing face, avoid wind in the face, diet, liquid or soft diet, and lastly, chew foods on the unaffected side. Ganon, 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 ganon. And then our next one is our abducens nerve. Magbibigay ako sa inyo ng tinuro sa amin dati na na mnemonic para dito, para ma-remember nyo. Besides sa sa function tayo na mnemonic, ganun. Function, our first one, sixth one is abducens. Abducens, di ba? Sabi kanina, may four lang na muscles ang involved sa oculomotor nerve. So, meron pang isa natitira. So, sideward and outward is the function of our abducens nerve. It controls the nerve. Okay, motor movement of eyes, side and out. Okay? Side and out. And ating involved dito is ang lateral rectus muscle. Lateral rectus muscle. Lateral rectus muscle. Movement of eyes, side and out. Lateral rectus muscle. Yun lang. Yun lang yun. Yun lang yun. Yun lang yun. Kanina sa ating fourth cranial nerve, our trigeminal, our trochlear nerve, ganito. Ganito, papasok, di ba? Papasok and pababa. Papasok and pababa. Papasok and pababa. Ngayon naman sa ating sixth cranial nerve, or abducens, pag ganon. Okay? Okay, malapit na tayo matapos. Okay, facial nerve. Facial nerve. Our facial nerve. May sakit na naman tayo dito. May isa namang sakit. Okay? May isa namang sakit. Okay? Facial is mix. Mix. Okay, mix. Our first one is our sensory. Sensory natin, bitter taste. Okay? Anong bitter taste? Taste lang. Taste. Okay? Taste. Okay? Ang SSS natin, SSS. Taste sa SSS, sweet, salty, and sour kay sensory facial nerve. Sa sensory function ni facial nerve, sweet, salty, and sour. Okay? Sa motor naman, motor function is facial expression. Okay? Facial expression. Okay? Facial expression. Facial expression. Okay? Facial expression. Ganun. Facial expression. Now, kapag sisirain natin, anong condition? Anong disease condition ang mangyayari? Anong result? We have what we call as Bell's palsy. Bell's palsy. Okay? Bell's palsy or facial paralysis. Kasi involved or damage ang ating cranial nerve. Kaya yan, mga 'di ba? Mga oral surgeries, pwedeng complications niya is Bell's palsy. But our usual cause is viral infection. Viral infection, example nito is mumps, measles, rubella, and varicella. It can cause Bell's palsy, especially if hindi treated properly or nagkaroon ng complication and na-damage ang ating facial nerve, magkakaroon ng ating Bell's palsy or facial paralysis. Okay? Signs and symptoms natin, unilateral facial paralysis or one side. One side lang. Kung anong nerve na side ang affected, kasi pair, di ba? We have to remember that our cranial nerves are paired sa right and sa left. So kapag sa right ang involvement, si lateral tayo, dun din ang affected sa eyes natin kasi hindi pa nangyayari dyan yung decussation natin. Okay? Unilateral facial. Actually, hindi ko alam kasi sa stroke na lang natin di-discuss yan. Basta unilateral paralysis, one side. Sa stroke naman kasi important yung right and left eh. Yung right and left, okay? Unilateral facial paralysis with ptosis, drooping of the eyelids, okay? Ptosis, drooping of the eyelids, okay? With ptosis, unilateral facial paralysis, drooping of the eyelids. Since ang cause is viral infection, usually ang management dito is antiviral to prevent. Such as acyclovir, to prevent damage, okay? To lessen the damage, okay? To prevent damage. Since viral infection, measles, mumps, rubella, varicella. So we have to treat it with antivirals, okay? Antiviral. So ayun, that is our second disease condition for today's video. Ayun. Medyo maiksi lang yan. Medyo mahaba kasi yung iba. Medyo mahaba kasi yung iba. Okay? Medyo mahaba-haba. Okay, our next one is our auditory nerve. Important. Auditory or vestibulocochlear nerve. Cochlear nerve or auditory and vestibulocochlear nerve. Basically, it's a sensory nerve. Sensory sensing for hearing and balance. Ganun lang yan. Hearing and balance. Okay, auditory or vestibulocochlear nerve. And number nine, ninth nerve is we have vagus. Vagus. It is mixed as well. Mix our sensory here. Sensory function niya is bitter taste. Kung kanina SSS kanina sa facial nerve, ngayon sa vagus nerve, bitter taste lang. Bitter taste lang. And sa motor niya is gag reflex. Gag reflex, ganun lang yan. So, gag reflex, okay? Ala, hindi, glossopharyngeal pa pala. Anong pinagsasabi ko? Ayun, glossopharyngeal. Mali yun na, sorry guys, sorry. Glossopharyngeal. Nagko-confabulate na naman tayo, okay? Sensory ng ating glossopharyngeal nerve is bitter taste, glossopharyngeal nerve, and motor is gag reflex. Ganun. Motor is gag reflex. And then next, na-excite ako tuloy sa vagus. Iba pala vagus, okay? Vagus nerve. Vagus nerve. It is mixed as well. Mix, mix function, and its sensory function. Sensory function is HCl acid secretion. HCl acid secretion. And our motor function here is vagal stimulation. Same then we stimulate vagal stimulation, it increases heart rate and also increases contractility. Okay? It decreases heart rate. Okay. Increases heart rate ba? Increases heart rate. Okay? Increases heart rate. Okay? Increases heart rate. Increases heart rate. Vagal stimulation. Okay? Vagal stimulation. Vagus nerve. And next, we have accessory nerve. Accessory. Basically, it is a motor, and involved dito, usually, motor natin for movement of shoulder and turning of the neck. Kaya nga motor, di ba? Turning of the neck, ganun. Movement of shoulder and turning of the neck. And our 12th nerve, last but not the least, is hypoglossal. Hypoglossal. Mali na naman spelling natin. Hypoglossal. Ayan, hypoglossal, movement of the tongue. Motor, movement of the tongue. Tongue. Mali yung spelling. Movement. Okay. Tongue movement. Ayun. 12 cranial nerves natin. So, ayan, para ma-memorize nyo ang ating cranial nerve, magbibigay tayo ng mga actions. Okay? Ng mga actions. Okay? 1. First cranial nerve, olfactory. Olfactory smell. Ganon. Olfactory smell. 1. Smell. Ganon. 1. Ganon. 2. Optic. Ganon. Two. Optic. Ganon. Since dito sa 3, movement of the eyes, ganito ang kamay natin. Sundin nyo lang ginagawa ko para maalala nyo. 3, movement of the eyes, and constriction of the pupil. Ganon. Movement of the eyes and constriction of the pupil. Ayan. 3. 1, 2, 3. Okay, sa 4 natin, movement of the eyes downward and inward. 4. Ganun. Okay, gets na? Sundan nyo lang ako. Dapat sumusunod kayo dyan. Sumusunod kayo. Kung hindi kayo naka-on cam, sundan nyo ako. Ganun. Ganun. 5, mastication. 5. Ganyan ka. Close, open kasi 5. Close, open, matas, umuya ka. Pikit ka kasi corneal sensation. Okay? Umuya and pikit. Ganon. Sa 5. Ganon ang ating 5. Ganon ang ating 5. Abducens naman. Abducens 5. And ayan, 6. Ganon. Pag ganon, palabas. Pag ganon, palabas. 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 6, 6, 6, 6, 6. Sa ating facial nerve naman, yan. Kasi facial expression. Magsa-selfie ka. Ganun. Facial expression. And sa taste na rin. Paano sa taste? Hindi ko alam. Paano sa taste? Hindi ko alam. Ganun. Kasi facial siya, facial movements. And besides that, tandaan nyo, facial nerve ang involved sa sweet, salt, and sugar na taste. Okay? Taste. Ganun. Ganun. Sa 8. 8 cranial nerve. 8 cranial nerve. 8. 8. 8. Ganon. 8. 8. 8. 8. 8. 8 cranial nerve. 8 cranial nerve, 8 cranial nerve, 8 cranial nerve. And 9, 9 cranial nerve, 9. Okay, i-draw natin. Number 9. Okay, papalitan natin 9. Parang G kasi siya. Okay, 9. Okay, glossopharyngeal, gag reflex, gag reflex. Kapag mapait, 'di ba? Kapag mapait kinakain mo. Kapag mapait kinakain mo, 'di ba? Bitter, bitter. Masusuka ka kaya gag reflex. Ayan. 9, 9, 9 tandaan mo. Glossopharyngeal, glossopharyngeal, gag reflex. Ayan, parang 9 sila eh. 9. 9 kaya para matatandaan yun. Ang bitter taste. Ganyan, ganyan, ganyan. And sa 10, sa 10, ganyan. Punta sa heart kasi HR, vagal stimulation, sa chan, HCl secretion. Ganon. 10. Okay, 10. 10. 10. 10. 10. 11. 11. 11. 1 and 1. 11 kasi 11. Ganyan. 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 And 12. 12. 12. Lastly, our 12 is movement ng tang natin. Okay. 12. Ganon. 12. Movement ng tang. Okay. Movement ng tang. Okay. Again, open cam tayo. Open cam tayo, mga mi. Open cam. Gusto kong makita. Gusto kong makita i-action natin. Okay, i-action natin from first cranial nerve and second cranial nerve, third, fourth, fifth, sixth, seventh, eighth, ninth, 10. Okay, open cam. Open cam. Again, parang recall lang. Recall. 1, okay, 2, 2, 3, okay, 3, 3, 4, 5, 6, 6, okay, 6, 7, 7, 7, 8, ganun, 8, 8, and 9. Sulat natin ulit. 9, 9, ganun, 9 kasi 9. Gag reflex, ayun, 9, 9, 9, parang ganun. Glossopharyngeal and gag reflex. Sa biggest naman, 10 natin, 10, 11, and 12. Ganon. Ganon. Okay, tapos na natin ang ating cranial nerves. Tandaan niyo na parang memory trick lang. Memory trick lamang para mas easier sa inyo. Para mas easier sa inyo. Mas mapadali sa inyo ma-memorize tong mga to. Kasi medyo madami-dami din. Medyo madami din. So, ayun. Ayun, let's proceed. Let's proceed to our first disease condition. So our first disease condition, which is our seizure. Seizure. Seizure tayo, mami. Seizure. So basically, in its simplest definition, seizure is a sudden, excessive, disorderly, electrical charges of neuron. Let me explain to you. Let me explain to you. Okay, let's find neuron. 2 neuron pictures. Ang pathophysiology niya. Ba't siya nangyayari? Okay? Neuron communication. Parang ganyan, di ba? When neurons are communicating with one another, when there are nerve impulses, di ba? They move, okay? They move the nerve impulses through Yeah, okay. They have different or electrical charges are moved from one neuron to another. Okay, electrical charges are one neuron to another. Based sa definitions, they're excessive firing of the neurons. Kasi hindi lang to dalawa eh, sobrang dami na. There is excessive firing of the neurons in the central nervous system, most particularly from brain, sudden, excessive, disorderly electrical charges or electrical firing of neurons, particularly in the brain. Usually kasi, 'di ba? We have two different neurotransmitters na involved when transferring information or when through for electrical impulses when firing things from one neuron to another. Our first one is our GABA or glutamate rather, glutamate. And our second one is GABA, okay? GABA, gamma aminobutyric acid. Okay, glutamate. Glutamate is excitatory neurotransmitter. And our GABA is inhibitory. Tandaan yun, inhibitory neurotransmitters. From the description itself, glutamate excitatory neurotransmitters, they excite the firing of from one neuron to another. Parang ganun. With these neurotransmitters, they excite the firing from one neuron to another. With GABA naman, inhibitory neurotransmitters, they stop. Okay? They usually stop or they decrease the firing, okay? They decrease the transmission of electrical charges from one neuron to another. Now, the problem with seizure, usually ang nangyayari based on theories is either ang cause na magde-decrease or super taas ng glutamate and super increase ang excitation or firing of from one neuron, a firing of electrical charges from one neuron to another. Kaya super taas ng glutamate. Or it can also be because of the fact na decrease si GABA. Kasi sabi natin, di ba, GABA is involved in stopping this, okay, in stopping this, in inhibiting or decreasing the electrical charging, okay, electrical charges or the firing of neurons. Pero kapag i-decrease natin si GABA, or si gamma aminobutyric acid, walang titigil, walang negative feedback basically for the electrical charges. So yun yung theory. Yun yung usually na cause or yun yung theory na cause or sa pathophysial, thus causing seizure. Ayun. Thus causing seizure, with glutamate being our excitatory neuron increased probably or decreased GABA, walang nag-i-inhibit ng transmission of nerve signals, causing seizure, or probably both. Okay, glutamate increase and GABA decrease. And sa pharmacology natin, with our seizures, hindi ko na i-discuss that deeply since pang medicine na yan. Okay, focus tayo sa nursing. I just wanna like extra information lang. Ayan. Dito nag-a-act ang medications natin. Either they decrease glutamate, or they increase GABA. That's how our anticonvulsants work. Gusto ko lang talaga maintindihan nyo yung simple na pathophysical na yon. Okay? Gets ba? Let's proceed with different types of seizures. Okay? Types of seizures. Our first one is grand mal seizure. Okay? Grand mal seizure. Okay? Grand mal seizure. Okay? Grand mal seizure. This is the most common, and usually it has two parts sa seizure na proper. We have tonic and clonic phase. Before that, one identification or one specific characteristic of grand mal seizure or these seizures is aura. Okay, usually may aura. Okay, aura, or the things that you experience that would symbolize, would signify that you may be having a seizure in a few seconds or in a few minutes. And ang aura natin for grand mal seizure is light flashes. Tandaan nyo yan, light flashes. Kapag mag-light flashes, I see flashes of light. Okay, sa question, ibig sabihin magsi-seizure na yan. That's an aura. Unusual smell. unusual smell, okay? Spots before eyes, yun na, light flashes, and dizziness, okay? Dizziness, okay? Dizziness, okay? That's our usual na aura with grand mal seizure. Okay, tonic and clonic phase, tonic and clonic phase, tonic and clonic phase of seizure. What do we experience here? What do we experience here? Shortness of breath, drooling of saliva, drooling of saliva, and urinary incontinence. Ihi ng ihi, gano'n. Urinary incontinence, okay, urinary incontinence. Kaya nga 'di ba, wet kasi, wet. Kapag nagse-seizure tayo, wet, tandaan niyo 'yan. Itatak niyo 'yan sa utak niyo, tatak niyo 'yan sa utak niyo kapag nagse-seizure tayo, wet. Wet, may drooling of saliva, increased secretions. Kaya sa intervention, ayan mamaya ha, mamaya papakita natin, okay? Urinary incontinence, wet. Basang-basa ang ating pasyente. Basang-basa ang ating pasyente. Again, basang-basa. Okay, we have tonic phase. Tonic is stiffening of muscles. And clonic phase, dito na yung jerky movements, okay? Jerking or twitching movements, okay? Clonic phase is jerking or twitching movements. Ayun, twitching movements. Tonic and clonic phase. Okay, aura, tonic, then clonic. And our last one is post-ictal phase. Normal lang ba mapagod ang patient natin or matulog ang patient natin for ilang oras after seizure? Normal ba or hindi? Normal. Yes, normal po, normal. Okay, normal. Okay, normal. Okay, our patients can have signs and symptoms niya, exhaustion, headache, HA lang ilalagay ko sa headache, drowsiness, parang drowsy ang patient natin, and deep sleep of 1 to 2 hours. Ganon. Deep sleep and disorientation. Okay, ayan sa post-ictal phase natin. Ictal, basically ang tonic-clonic phase natin is our ictal phase, ictal seizure phase, and after seizure phase or post-ictal phase is our here, post-ictal phase. Ayun na nga, that is our grand mal seizure. Yun lang ninyo tandaan about sa ating grand mal seizure. Of course, we have aura ha, aura. Okay, next is our absent seizure or our petit mal seizure. Okay? Petit mal seizure. Absence, petit mal seizure. Take note nyo na sa absent seizure, walang aura. Wala ding no tonic-clonic movements din. No aura, no tonic-clonic movements, but there is still, since it's a seizure pa rin, there is still excessive firing of things in the brain, pero hindi siya characteristics ang aura. And hindi din, wala din jerking movements, walang twitching movements, no stiffening of the muscles. And how do we identify absent seizures? Okay? Sudden cessation, sudden stop of physical activity. Sudden stop of physical activity, and ang ID niya or signs and symptoms niya is black facial expressions. Handaan niya yan. Absent seizure na yan. Nakatunga nga lang ganun. Parang hindi mo na siya maaano. Hindi mo na siya gigising sa katotohanan. Parang ganun. Gigising sa katotohanan. Expression. And automatism. Same din sa ano, 'di ba? Same din sa pag-take natin ng antipsychotics. Okay, may automatisms. Acute dystonia, ayun ba 'yun? Okay. Lip chewing and cheek smacking. 'Yun yung automatisms natin. Automatisms, lip chewing and cheek smacking. Parang gano'n. Parang gano'n. Okay? Parang gano'n. Okay? Pero ang difference niya with other types of seizures is consciousness is rapidly regained. It's as rapidly regained as it was lost. Okay? Ayun, ganun yan. It was rapidly regained as it it was lost, and it lasts usually from 20 to 10 to 20 seconds. Ganun. 10 to 20 seconds. And common occurrence here is children and adolescent. 'Di ba tahimik-tahimik lang yung kasama ko nagse-seizure na pala hindi mo alam kasi petite nga, nakatunga nga lang sa ganyan, nakatunga nga lang blank facial expression, gumaganon-ganon na siya, nagpe-petite mal seizure na pala ang ating friend. Friend, ba't di ka nagre-react sa mga jokes ko? Nakakatuwa nga siya, eh, nakakatuwa nga siya. Okay, our next one is our Jacksonian or our focal seizure. Jacksonian or focal seizure. Focal, specific part lang ng ating body ang seizure. Hindi generalize sa hindi generalize. Okay? Kanina general, grand mal seizure. Ngayon, focal seizure. Certain parts lang ang magkakaroon ng tonic and clonic phase. Okay? This is common for frontal lobe tumor are usually ang cause ng ating focal seizure is frontal lobe tumor and it's organic brain lesions. Okay, ang aura natin dito, ang aura or the things that we experience for seizures, the signs and symptoms na magsi-seizure na tayo is numbness of the area. For example, sa right arm ang magse-seizure, mag-focal seizure sa right arm, okay? Kasi may part ng brain na involved sa right arm, parang gano'n. Numbness, tingling of that extremities, and lastly, crawling feeling, okay? Crawling feeling, gano'n yung aura natin, okay? Gano'n yung aura natin. And how do we identify this signs and symptoms? There are tonic-clonic movements that can proceed to a grand mal seizure. Okay? Magtotonic-clonic movements muna and it can proceed. There's possibility proceeds to a grand mal seizure. Okay? Kapag isang part lang ng body natin ang affected or probably ganyan, matic Jacksonian seizure na yan and it proceeds to a grand mal seizure, okay, or generalized seizure. Our next one is the one that has psychiatric component, which is our psychomotor seizure. Basically, nandito yung nag-aamok, parang ganun, nag-aamok, may ginawa kang activities na lahat, pero paggising mo, wala pala. Parang ganun, hindi siya sleep disorder. Nag-aamok nung na-realize niya na napatay na yung pamilya niya. Hindi niya alam na ginawa niya pala yun. Dito yan, psychomotor seizure. May rapid firing sa brain niya, kaya nagkaroon ng pag-aamok ang ating pasyente. Ganon, ganon yan. Nag-amok, okay? This is psychiatric component. Good example nitong hamok ha, psychiatric component. This is psychiatric component. Ang aura natin, since may psychiatric component is hallucination and delusions. And delusions. Yan ang aura natin. How do we identify this? Signs and symptoms natin. There is loss of consciousness with physical activity. Okay? With physical activity, may ginagawa siya pero may loss of consciousness na. Okay, may loss of consciousness. Hindi niya namamalayan yung mga ginagawa niya. Hindi niya namamalayan. Okay, loss of consciousness nga pero may ginagawa siya. And good example of this is pag-aamok. Okay? Usually the appearance of our patient is intoxicated. Parang nalasing. Parang nalasing yung ating pasyente. Confused. Amnesia. Okay? After, especially sa post-ictal phase niya. Amnesia. Need for sleep. And violence. Okay? Yun yun. Pag-aamok. Violent. Antisocial act. Parang naghubot-hubad na. Ganon. Ganon yun. Ganon yun. Basically, yun lang yung need natin mga psychomotor seizures. Pag-aamok. A good example is pag-aamok. Okay? Next is febrile seizure. Number 5 na ba? Okay. febrile seizure tayo mga mi. Febrile seizure. Ang pangit talaga ng penmanship ko. Magta-type na lang ata ako. Pero mas masaya kasi pag nagdo-draw, di ba? Mas maganda mag-explain ng mga pathofacial. Di ba? Pathofacial. Okay, usually, tandaan nyo lang dito, usually common in children less than 5 years old. Ganun lang yan. When temperature is rising. When temperature is rising. When there is rising temperature. And lastly, number 6 is our status epilepticus. So how do we define? How do we define status epilepticus? Okay? Seizure in rapid succession, seizure lang, full consciousness is not regained between those C's sa pagsi-seizure ng ating pasyente is not regained, okay? Is not regained. Seizure in rapid succession, dire-diretso lang. If mag-stop lang, if mag-stop naman ang seizure natin, hindi nare-regain ng patient natin ang kanyang consciousness niya. And this is an emergency. Okay, emergency. Kasi di ba, sabi natin, every time na nag-seizure, nag-rapid firing ang ating brain. And when our brain does something or our neurons does something, nagkakaroon ng metabolism, di ba? It it uses energy to do something and it uses oxygen as well. Okay, it uses oxygen, may metabolism na nangyari, may process na nangyari. It uses energy and oxygen to process that. Imagine, dire-diretso, work ang ating neurons. Anong mangyayari? 'Di ba hindi supply, hindi maso-supply ng ating body ang demand for oxygen ng ating brain kasi 'di ba tumaas yung demand ng oxygen ng ating brain. Ayun. That's why it can cause hypoxia. Hypoxia, okay? Status epilepticus. That's why it is an emergency, okay? Hypoxia, prolonged hypoxia can cause brain damage. Brain damage. Okay. Prolonged hypoxia can cause brain damage. Okay, basically exhaustion na rin ng ating neurons. Exhaustion ng ating neurons. Hypoxia of neurons and exhaustion of neurons. Kasi di ba, every time that they do something, they act on something, they transmit signal from one neuron to another. Yes, electrical impulses, they use O2 or oxygen. So imagine if fire sila ng fire and hindi masosupply ng oxygen ng ating body, ang ating neurons, hindi masosupply ng ating lungs, okay? Kasi sobrang taas na ng magkakaroon ng hypoxia and exhaustion, ganon, leading to brain damage, ganon, leading to brain damage. Usually the patient is coma for 12 to 24 hours or longer, okay? Or longer with their current seizures, okay? With their current seizures. Ano usually ang cause, okay? Ano usually ang cause? That's why isa sa mga nursing intervention natin na ituturo natin sa ating patients. Na nagsiseize, or my seizure causes are usually sudden withdrawal of medication, sudden withdrawal of anticonvulsants, and lastly, failure to take anticonvulsants. Same din, okay? Again, important lang na ninyo tandaan dito, sudden withdrawal or failure to take anticonvulsants, okay? Sudden withdrawal and failure to take anticonvulsants. It has to do with, nalimutan ko yung term. It decreases the seizure threshold kasi decreases the seizure threshold once you stop or once you withdraw from these medications or you fail to take this medication. That's why pwedeng mag-cause ng status epilepticus. When you decrease the seizure threshold, mas mas lesser ang need mo to have seizure. That's why mas higher, mas greater ang seizure na effects, okay? Mas madaming seizure na mangyayari because of the decreased seizure threshold. Buti naman naalala ko. Okay, buti naman naalala ko. And number 7 is tinatawag natin na epilepsy. Epilepsy, basic lang to. Basically, the definition of epilepsy is more than two seizures, unprovoked seizures, more than two seizures, more than two or more seizures within or less than 24 hours apart. Parang ganun. Okay? More than two seizures, less than 24 hours apart. Tingnan ko if tama yung definition ko. Epilepsy definition. Okay? Medical. Less than ba? Or ano? Wait lang. Within tama, two or more seizures, two or more unprovoked seizures within 24 hours, okay? Two or more unprovoked seizures within 24 hours. Yun lang ang definition ng epilepsy natin. It can either be seizures, pwedeng combinations of seizures, pwede madaming seizures. Basta, you're diagnosed, epilepsy na. Epilepsy, if you have more than two or more seizures within 24 hours apart. Okay, let's go with pharmacology. Okay, I think isa lang di-discuss ko with our pharmacology, ating phenytoin lang. Kasi makakapos talaga tayo sa time ng ibang topics if magdi-discuss pa ako ng iba, such as levetiracetam, our carbamazepine, and our valproic acid. Okay, okay, let's just discuss our phenytoin kasi ang dami-dami na sa phenytoin eh. Phenytoin. Okay, phenytoin. Medical management. Management of seizure. Our first one is phenytoin. First one is phenytoin. Ano need nyo tandaan? Ano need nyo tandaan sa ating phenytoin? It is used for long-term protection against seizures and our therapeutic range is 10 to 20 micrograms per DL. Okay? 10 to 20 micrograms per DL. And kapag less ito, less than 10 micrograms per DL, it increases seizure risk. Okay? Seizure risk. Okay? Seizure risk. That's why we have to report to physician. Okay? Report to our HCP kapag i-check natin. Kasi nagba-blood draw to eh kapag nag-take kasi very narrow therapeutic index. And that's why kapag blood draw and nakikita na less than 10, there's increased seizure risk. That's why we have to report to HCP or our healthcare provider or doctor. Then kapag more than 20 naman, more than 20, it can cause toxicity. Okay? Toxicity. That's why you hold the next dose and report. Ganun lang. Hold the next dose and report. And what are the signs and symptoms of toxicity? Okay? What are the types, signs, and ataxia? Okay? First one is ataxia or unsteady or disturbance in gait. Kapag gumaganon-ganon na, kapag naglalakad, parang lasing na ang ating pasyente and nagtitake siya ng phenytoin. What are we gonna do? We have to hold and report to our HCP. Pwede din hand tremors. And lastly is slurred speech. Yan ang ating signs and symptoms ng ating toxicity. Yan ang ating signs and symptoms with our toxicity. That's why we need routine blood tests. Routine blood tests, okay? Routine blood tests. Most particularly, since hepatotoxic tong medications na to, hepatotoxic, we need to check for the liver function tests. Liver function tests because it cause liver failure. It can cause fibrosis of the liver, leading to fibrosis. Iba na yun. Hepatitis naman yung hepatitis. Okay. Can cause liver failure. Okay. Liver failure. And how do I administer this drug? Administration. Okay. Take administration. Take same time each day. Ayan, same dapat kapag alas 5 ng hapon, alas 5 ka dapat magte-take. Bakit? Bakit? Kasi narrow nga ang therapeutic index nga. Probably kapag super early ka mag-take, for example, 5 kayo yesterday nag-take and 3 p.m. ka nag-take, pagka next day, pwedeng mag-cause ng toxicity. Okay, mag-increase, or kapag late ka naman nag-take, pagka next day, late ka nag-take, pwedeng mag-cause ng seizure risk because it has narrow therapeutic index. Okay, narrow therapeutic index. What are we gonna note for the adverse effects of this medication? Adverse effects, we have suicidal ideation. Okay? Suicidal ideation. And next is SJS, or the Stevens-Johnson's syndrome. Okay? Stevens-Johnson's syndrome. Yan yung parang tawag dyan, ICU, it's an critical care condition na. Critical care condition, may nagbabalat-balat na yung skin, parang burns siya. And it starts very simple pa. Pero dahil sa reaction ng drug na yon, nagkakaroon ng Steven-Johnson syndrome ang ating patient. And usually, meds like phenytoin can cause Steven-Johnson syndrome. And how do we know? How do we know na pwede yan na SJS? New and painful rash. Okay? New and painful rash. Kapag sasabihin ng patient na may new and painful rash siya, ikaw sasabihin din ng patient na parang ayaw niya nang mabuhay, ganyan. Ayaw niya nang mabuhay. That is a red flag of the medication. Adverse effects yan ng ating medication. And our side effect, especially important na ating side effect is gingival hyperplasia. Hyperplasia of the gums, okay? Hyperplasia of the gums. Nag-i-edema. Hindi naman edema, parang inflammation. Parang hyperplasia talaga yung gums natin, okay? Nag-hyperplasia ang gums natin. Since gum involvement, how do we treat this? Okay? How do we treat this for our patient? How do we treat this? Our nursing interventions for this is oral care. Oral care. Most importantly, dapat ang toothbrush natin is soft bristled toothbrush. Okay? Soft bristled toothbrush. Ganun lang na yan. Okay? Soft bristled toothbrush. Okay? Okay? And we have to teach as well. Our patients. To not take COC, okay? Not take oral contraceptives. Why? Not take oral contraceptives because it blocks the action of our oral contraceptives. That's why we have to teach our patients to have alternatives, okay? Have alternatives such as IUD, okay? Alternatives such as IUD. And of course, tinuturo nga kanina, every time na ang patient natin nagtitake po ng ating anticonvulsants, never stop abruptly because it can cause status asthmaticus, okay? Status asthmaticus, okay? Status epilepticus. Pinagsasabi ko. Okay, pinagsasabi natin, Mami. Nagsasabi natin, Mami. Moments. That is epileptic. Because that's why we don't have to stop abruptly. Dapat taper, pero hindi talaga pwede. Kasi may seizure na nga siya. Mag-seizure yan ulit kapag i-stop natin yung medication. Okay, continuous dapat. Continuous. Okay, then we have to teach them to have vitamin supplementation. And that is B9 or folic acid, calcium, and vitamin D, because this medication blocks folic acid absorption and also decreases bone density. Note nyo yan, take note ng reasons. Decreases folic acid absorption and decreases bone density. And ang effects niya naman sa heart is decreased heart rate and decreased BP. Okay, decreased heart rate and decreased BP. Kaya cause bradycardia and hypotension. Ayun. Yun lang din natin i-take note sa ating phenytoin. It has very narrow therapeutic index. That's why you have to take it at the same time. Each day. Okay. Try ko na lang. I-verbalize ko na lang. Ay, hindi na kaya. Okay. Hindi na kaya. Okay. Sa carbamazepine pala kanina, ang need nyo i-take note, isulat nyo na lang dyan. Okay. Sulat nyo na lang dyan. Hindi you take note, the adverse effects ng ating carbamazepine is leukopenia, mga mi. Leukopenia. That's why mag-i-infection. That's why we have to report if magkaka-fever or sore throat ang ating pasyente. Ano na tayo, okay, neutropenic precautions. Parang ganon. Parang ganon, okay? So we have to report sa ating healthcare provider if may fever or sore throat ating patient because nag-i-immunocompromise siya. Okay, nai-immunocompromise ang patient natin. Adverse effects yan, red flag yan. Hindi na siya normal. And another one is it blocks the action of our oral contraceptives. That's why it can cause accidental pregnancy. Same then alternative, for example, is IUD. Ganun lang. And most important, yun talaga, tandaan nyo sa carbamazepine, leukopenia. Leukopenia, and it can cause as well, especially sa mga Asians, ng SGS or tinatawag natin na Stevens-Johnson's syndrome. Dami-dami kong pinagsasabi. Dami-dami kong pinagsasabi. Okay? Our nursing management. Okay? Our nursing management of seizure. Okay? Nursing management of seizure. Seizure pa lang tayo. Imagine that. Dami-dami pa natin i-discuss. Okay, nursing management of seizure. First one is stay with client. Stay with the patient. Stay with client. Stay. Huwag mo siyang iiwan, mga mi, kasi may problema siya. Okay, our general principle, para matandaan nyo, kahit hindi nyo na i-memorize, yung ating ang ating mga interventions. Alam niyo na kung anong gagawin kapag nagsisira ang patient. First one is safety. Safety. And the next one is airway. That is our general principles. Okay? Airway. Sabi nga natin wet. Wet ang ating patient kanina. Wet ang ating patient na nag-seizures. That's why we have to protect the airway. We have to protect the airway kasi nagdo-drool yung saliva nila, daming salivation. And of course, safety, of course, nag-jerky movements yan. Pwedeng ma-head, yung gano'n, matutumba ang ating patient, magkakaroon ng traumatic head injury, and other part injury dyan na pwede nating i-injury sa patient natin. Okay? Okay, again, safety and airway ang ating general principle. Okay, first one is with the client and second one is airway. Airway, ito ang ating isang priority. Isang priority, we have to turn client to side. Okay? Turn client to side. Side to side. And the next, para makahinga ang ating maayos ang ating pasyente is loosen clothing, okay? Loosen clothing, loosen restrictive clothing, particularly around the neck, mga mi. Particularly around the neck, okay? Around the neck, particularly around the neck. Ayan, kasi para sa airway natin, that's why we have to turn the client to the side. We have to turn the client to the side. And iti-teach ko sa inyo ano dapat always nasa bedside ng ating pasyente. Bedside ng ating pasyente. Okay. The next for our safety. Safety. Dapat may padded side rails. Okay? Padded side rails. Para naman hindi mababangga ang patient natin. Side rails up. Side rails up. Para hindi mahulog ang ating pasyente. Side rails up. Padded dapat. Para hindi injury ang ating pasyente. No injury. Okay? Kapag sitting or standing, naman ang ating pasyente sitting or standing, we have to ease on the floor first. Ease on the floor. Okay? Again, ease on the floor. Then protect head. Protect head. Ease on the floor. Protect head using a small pillow or your thigh. Okay? Or your thigh. Okay? Okay? Ease on the floor. Protect head using a small pillow or on your thigh. And next natin i-take note is do not restrain our patient. Okay? Do not restrain. Never natin i-restrain ang patient natin. Kasi mas lalo pang magsiseize ata based sa evidence-based na information. Okay? Hindi sa ICP pala yun. Basta never restrain. Okay, never restrain kasi nagja-jerky movement siya. Hayaan mo lang gumanon-ganon patient mo. Okay, hayaan mo lang gumanon-ganon basta protected and padded. Padded ang ating side rails. Kahit ibangga-bangga niya yan, hindi siya and soft din yung bed niya, parang ganon. Okay. The next one is do not Do not, do not insert tongue blade, okay? Insert tongue blade. Kasi 'di ba, dati sabi sa theory, we use tongue blade kasi yung tongue puwede daw magfa-fall and maka-close yung airway, gano'n. Pero na-prove na hindi pala siya totoo, it's just a myth, it's a medical myth, it's a medical myth. That's why we don't insert tongue blade anymore because it can cause trauma to the gums and teeth, ayun. Trauma to the gums and teeth. Ayun, let's go. Let's practice question. Okay, seizure. Our first question. Ready na ba? Ready? Gusto ko sasagot kayo sa ano ha? Sasagot kayo. Para masaya naman. Sasagot tayo. Okay, number one. Number one, mga mi, number one. The nurse is documenting nursing observations, the record of a client who experienced tonic-clonic seizure. Okay? Tonic-clonic seizure. Which clinical manifestation did the nurse most likely note in the clonic phase? Okay, tandaan na clonic phase of seizure. So, positive ang hinahanap natin. Positive, tandaan nyo yung paggamit ng positive and negative. Positive kapag true, negative kapag false. Positive step, negative step. Positive answer, negative option. Parang ganun. Positive option, negative option. Okay. Okay, okay, okay. Clonic phase tayo. Second phase. Body stiffening ba? No, kasi it is a tonic phase. Okay, it's tonic phase. Brief flexion of the extremities ba? Brief flexion of the extremities? No, hindi din brief flexion of the extremities. Sudden loss of consciousness ba? No din, no din, no din. Ang definition natin kanina, di ba? Definition natin, flexion of extremities. Definition natin kanina is twitching. Twitching or spasms. Spasm, jerky movements. Rewording lang to. Rewording lang to ng ating clonic phase. Okay, rewording lang. Okay, rewording lang ng twitching. That's why our answer. Okay, gusto kong sumagot lahat. Gusto kong sumagot lahat. Kaya important yan yung ginagawa natin sa board exam. Okay, yan ang ginagawa natin sa board exam. Sumagot. Okay, sumagot. Let's go. Sagot tayo mga mi. Sagot tayo. That's why our answer. Anong answer natin? Answer natin? Answer natin, ayan. Ayan, ayun na, rewarding, twitching, jerky movements of the entire body. In the entire body, okay? Kasi ano to, grand mal seizure na siya, okay? Grand mal seizure. That's why this is our answer. Letter B, ganun lang yan. Which assessment data daw should the nurse obtain when completing a health history? Health history on a client with a seizure disorder. Okay, with a seizure disorder. Sa vital signs, part ba yan ng physical exam? Part ba yan ng physical exam? So, Ekis, okay? Hindi siya nursing health history, okay? Hindi natin mataas yung nursing health history. LOC, part ba yan ng physical exam? Part ba yan ng physical exam na assessment? Yes. Yes. So, Ekis din. Anong answer natin? C or D? C or D? C or D,
C.
mga letter C or D. Letter C or D. Let's go. Let's go. Let's go. Let's go. Hindi siya C, kundi D. Presence of auras. Kasi tinatanong dito. Ayan. Ayan. Tandaan nyo yan. Tandaan nyo yan. If nag-a-answer kayo ng PNLE questions, PNLE questions, ang isasagot nyo yung tinatanong lang. Tinatanong. Kasi hindi naman tinatanong na physical exam yun. Hindi tinatanong physical exam eh. Health history yung tinatanong ni health history. Asan dyan ang pwede mong i-ask sa patient na hindi mo i-check siya sa patient. Hindi mo i-check sa patient pero tatanungin mo siya, may history ka ba? May history ka ba ng oras before ka nagka-seizure? Ganon. Sa neurologic exams kasi, neurologic exam part na siya ng PA natin. So, asan health history yan? Asan health history dyan? Ayun, presence of aura. Ganyan. Find context clues. Always. Always when answering practice questions, find context clues. Okay. The nurse creates a plan of care of a child at risk for tonic-clonic seizures. And plan of care, the nurse identifies seizure precautions. Seizure precautions daw ha. Yun, seizure precautions yung nandun kanina ha. Seizure precautions. And documents which items is needed to be placed at the bedside. Okay? At the bedside. Okay? At the bedside. Okay? Emergency cart ba? Sa bedside ba ang emergency cart? Sa bedside ba? Bedside, hindi general na place ang ano, 'di ba, sa unit natin, sa nursing unit. Hindi siya sa bedside. Okay, especially if sa ward, parang nandun malapit sa nurse station, gano'n, parang push na lang, gano'n, push na lang. Or nasa labas ng room ng patient natin, so hindi. Hindi yan. Okay, tracheostomy set. Nagta-tracheostomy. Imagine, nagsi-seizure na yung pasyente natin, bubutasan pa natin dito. Medyo mahihirapan tayo na. I-restrain tayo yung pasyente para magta-tracheostomy tayo. Okay? Para magta-tracheostomy tayo. So, X din. Kaya nga hindi tayo nagpa-place ng ano, 'di ba, intubation may ano na kaya bubutasan natin pasyente ng 'di ba, bubutasan. Hindi, padded tongue blade sabi nga 'di ba, hindi na puwedeng padded tongue blade, nanggigigil ako. Okay, so ang tawang sagot since nagpo-produce nagdo-drooling up saliva ang ating patient, we have to have suctioning equipment and need natin in case, okay, nagha-hypoxia ng pasyente natin, need din natin ng oxygen. That's why our answer is letter Z. Letter Z. Letter Z. Okay, letter Z for daddy. Letter Z for daddy. Client is having tonic-clonic seizure. Nurse should take which of the following actions? Interventions natin mga mi. Interventions natin. Positive. Positive. Okay, restrain client, true or false? Okay, gusto kong sumagot kayo dito sa chat ngayon. Gusto kong sumagot kayo ngayon. Yung true or false. Letter A, true or false? Okay, negative, false yan. And then airway, true or false? True or false? True. Okay. Turn client to the side. Same lang ba yan sa maintain airway? Okay? Okay. Yes, we have to turn the client to the side para hindi mag-aspirate. Okay. Place tongue blade in the mouth. Place tongue blade in the mouth. True or false? False. Okay, false. Okay. Protect the client from injury. Protect the client from injury. Protect, yes, yes, yes. Safety. Safety ng ating pasyente. That's where our answer B, C, E. Ganun lang yan. Mas madali sa PNLE kasi may choices tayo ng ano, ng ating mga ano, kunyari, A, ganyan, 1, 2, 3, parang gano'n. May choices tayo sa PNLE, so mas madali siya. Mas madali yung buhay natin sa PNLE. Walang SATA na puro SATA na SATA, gano'n. That's our answer is BCE. Gano'n lang yan. Okay, BCE. Last questions. Nurse providing instruction about dilantin or phenytoin, which statement if made by the client would indicate understanding, so positive, true statement, information about medication. O letter D, I should monitor for side effects and adjust my medication dose depending on how severe. Okay, nagdodoktor-doktoran na naman tayo. Nakakainis. Nagdodoktor, walang prescription. Hindi puwedeng mag-titrate ang pasyente natin mga mi. Hindi nagta-titrate ang pasyente natin ng medication. So, X yan. Okay, letter C. Okay, sagot na kayo. May sagot na kayo. I should take my medication before coming to the laboratory. I have blood level drawn. I should take the medication ba? Hindi. Hindi ko alam. Actually, usually. Okay. Hindi din. Okay. I should try to avoid alcohol, but if I'm not able to, I can drink alcohol in moderation. No. Ang reason dito is ang alcohol, it increases the excretion of phenytoin, which can cause seizure risk. Okay? Which can increase seizure risk. Okay? Kasi letter C mali din kasi magte-take ka lang ba ng medication right before your laboratory, that will excessively increase the amount, magkakaroon ng false positive na pwedeng nagto-toxicity na yung pasyente natin. So, X din letter C. That's why our answer is letter A. Okay, sagot tayo mga mi. Sagot. Ayun, letter A. Gagaling. Pwede naman top toucher. Okay, ayun lang. 5 questions. Paano naman maa-assess kayo? Maa-assess. Okay. Okay, let's go. Let's proceed with our ICP. Hopefully, matatapos natin. Kahit tatlong disorders. Mamaya na yan si PD. Parkinson's disease. Okay? Parkinson's disease. Okay. Medyo ano to? Medyo madugo to. Medyo madugo. Basically, increased intracranial increase ICP na nga, nanggigigil ako. Nanggigigil ba tayo? Yes, nanggigigil. Sabi na nga, increase ICP, dinagdagan pa ng iba. Okay, increase ICP tayo, mga mi. Okay, basic definition muna tayo. Basically, ang nangyayari sa increase ICP is their increased intracranial
Sure.
bulk. Okay? There is increased intracranial bulk, increasing pressure in the cranial vault. Thus, causing cerebral hypoxia. Parang ganun yon. Thus causing cerebral hypoxia. Parang ganun yun. Para it's more complicated than that. This is just simplified, okay? This is just simplified version of that, okay? This is just simplified version of that. Basically, parang ganon, parang ganon. Basically, most of the science symptoms will revolve around this. Besides sa pressure, the cerebral hypoxia din, no oxygenation. We have to take note, we have our CPP, or cerebral perfusion pressure, or pressure of perfusion, oxygenation into the brain. Okay, that's, merong value yan, okay? Merong value yan. Our normal CPP should be 60 to 100 mmHg of pressure. Okay, 60 to 100 to maintain the normal functioning, or the normal perfusion pressure, para ma-perfuse ng maayos lahat ng parts ng brain natin, para may oxygenation sa lahat ng brains natin, sa lahat ng parts, ganun, sa lahat ng parts ng ating brain, okay, ng ating brain. Then we also have CPP is defined as MAP, or mean arterial pressure, minus mean na pressure sa entire body natin, mean na pressure sa entire body, sa lahat ng arteries natin, blood vessels, lahat na pwedeng blood vessels, minus ICP. Based on that definition, malalaman natin kapag magde-decrease sa IPP, mag-i-increase sa ICP, de-decrease din sa CPP, okay? MAP, our normal value here is 70 or 80 to 100, depende sa reference natin, okay? 70 to 100. And our normal ICP, tandaan nyo to, normal ICP is 5 to 15 mmHg. 5 to 15 mmHg. Ayun, 5 to 15 mmHg. Imagine CPP natin. Ito dapat i-maintain natin na value, Ito dapat i-maintain natin. For example, CPP equals, may MAP tayo na 80 mmHg, and nagkaroon ng increase intracranial pressure. Meron tayo, wait lang, super taas. Okay? Meron tayong probably around 30 mmHg. Tingnan nyo anong result. 50 mmHg na lang siya. 50 mmHg. Sa tingin nyo, effective ba yan? To perfuse the brain? Enough ba yan to perfuse the brain? No. It can cause cerebral hypoxia. That's why one of the pathophysiology, one of the causes, or one of the effects of increased intracranial pressure is cerebral hypoxia. We have to maintain the perfusion of the brain at around 60 to 100. Now that we can see sa equation na to, kasi minus dito sa side na to, when we have to increase this, it causes a decrease in this cerebral perfusion natin. That's why sa increase intracranial pressure, it causes cerebral hypoxia. Now we have different volumes of the brain, okay? Volumes of our CNS, okay? Different volumes of our CNS. We have the brain, blood, and CSF. Okay? Brain volume, blood, and CSF. Ang brain volume natin around 80%, 10% for our blood volume, and 10% for our CSF. Okay? 10% of our CSF. Now, for example, tataas si brain volume natin. Our great cause of that, usual causes, cerebral tumor, abscess, edema, probably from infection or trauma. Kapag tataas yan, based sa Monroe-Kelly or Kelly-Monroe hypothesis, if one contents of this increase, if one contents or one volume of the brain increase, this will decrease. These two will decrease. Two of the components decrease to maintain and its equilibrium. Now, sa increased intracranial pressure, ang nangyayari dyan, hindi nakaka-comply. Wala nang compliance, okay? Hindi na nakaka-adjust, okay? It cannot maintain the equilibrium. Kahit i-adjust mo pa yan, kahit i-decrease mo pa yan sila, cannot maintain the equilibrium, okay? Equilibrium rather. Okay, ang taas pa rin ng pressure doon. Ayun, si Monroe Kelly hypothesis or Kelly-Monroe hypothesis. Tandaan nyo na, Kelly-Monroe hypothesis, if one of the volume increase as a compensation, two volumes decrease. The other two volumes were decreased to maintain equilibrium. To maintain balance, okay? Equilibrium, ganun yan. Okay, okay, okay. Again, brain volume causes increased brain volume. Okay, lagay na natin para visual na tayo pala. Brain volume. O, pwedeng cause yan, brain volume. Pwede din, okay? Sabi natin kanina, di ba, brain volume causes cerebral tumor, abscess, edema, probably from infection or trauma, or pwede din increased blood volume. Increased blood volume. Okay, increased blood volume, increased brain volume. Pwede din increased brain volume. Probably example that is cerebral hemorrhage. Okay, cerebral from AV malformation, mga ganyan. Okay, intracranial hemorrhage tayo. Okay, thrombosis, embolism, aneurysm. This all can cause increased blood volume. The other cause is increased CSF. Increased CSF. And our usual causes with increased CSF is obstruction of CSF outflow. Hindi nakakalabas. Okay, nakakalabas. Usually, sa brain tumor. And classic dyan is hydrocephalus. Okay? Hydrocephalus. Or pwede din overproduction of CSF when we have choroid plexus tumor. Okay? When we have choroid plexus tumor. Pwedeng maging cause yan ng increased ICP. Now, all of these things, one thing lang ha, hindi sila lahat sabay-sabay ha. Tandaan yan. Pinapakita ko lang. Hindi sila lahat sabay-sabay, mga kami. Hindi sila lahat sabay-sabay. Hindi yan sabay-sabay. Okay? Hindi yan sabay-sabay. Magkakaroon tayo ng brain swelling or swelling na lang. Swelling. Increase intracranial pressure. Ayun na. Increase intracranial pressure. Now, sabi natin sa Monroe-Kelly hypothesis, meron tayong negative feedback to stop the increase. Okay? Our first intracranial compliance is to decrease CSF. And usually, at this point sa ICP natin, asymptomatic pang ating patient. Symptomatic. And then next, if hindi makaka-comply, if hindi niya ma-maintain ang equilibrium with this first intracranial compliance or decrease in CSF, we have our second intracranial compliance. Our second intracranial compliance, lagay ko na ganyan, which is our decreased blood volume. And dito na ang signs and symptoms natin. Symptomatic na ang ating pasyente, ganon. Symptomatic na ang ating pasyente dito. This is where brain hypoxia occurs. Ayun nga, simplified lang ng kanina. Ito, medyo detailed na, okay? This is where brain hypoxia occurs. Okay? Kapag nagbe-brain hypoxia, kapag walang oxygenation sa brain, meron tayong, ma-divide natin ito into two parts, okay? If O2 is reduced less than 40% lamang, O2 is reduced less than 40%, and O2 is reduced less than 60%. Kapag O2 is reduced less than 40%, dito natin makikita ang early signs of ICP. Ayan, tandaan nyo yan. Early signs of ICP. Early signs. Mareremember natin din sa car, vroom, vroom. Parang ganun, car, vroom, vroom. Early signs of ICP. Okay, early signs of ICP. Basically altered LOC. Masisimplify natin ito with altered LOC. We have changes in behavior, car, vroom, vroom. Behavior. Ayan, car, vroom, vroom. And we also have an altered LOC or level of consciousness, altered LOC and restlessness. Okay, restlessness. This is the early signs kasi less than 40% pa lang, of hypoxia, of oxygenation ang natanggal. Okay, ang natanggal. That's why we have these signs and symptoms. Sabi nga, 'di ba? One of the main causes of signs and symptoms with this one, with ICP is decreased ICP or decreased oxygenation or hypoxia. Ayun, hypoxia. When the O2 is decreased naman less than 60%, the brain undergoes anaerobic metabolism. Delikado na to. Anaerobic metabolism. the brain undergoes anaerobic metabolism, and it can go in two ways, okay? Anaerobic metabolism nga, sabi ko, explain ko last time, can cause acidosis. Kasi, di ba, less oxygen, more CO2 causes anaerobic metabolism, causing acidosis, which can cause acidosis dahil sa formation of lactic acid. And we know that lactic acid causes pain. That's why naghe-headache ang ating pasyente. Okay, that's why naghe-headache ang ating pasyente. And besides that, besides sa acidosis, other thing that causes acidosis is a brain, di ba? Brain is surrounded by meninges, and we know that this meninges has sensitive pain, pain sensory receptors. Okay, pain receptors. Dahil sa increased ICP, di ba? Increased brain size, when these things are irritated, it can cause meningeal irritation, thereby causing headache. Ganun lang yon. Ganun yan. Two causes ng headache natin from our acidosis. And other one is meningeal irritation. Now, when our brain undergoes anaerobic metabolism, then decreased CO2, and nagkakaroon na ng acid-base imbalances, there's further increase in brain size. Ayun. Further increase in brain size. Nagpa-positive feedback siya, no, which is delikado. And this further increase in brain size can increase or can cause pressure in brain tissues. That's why we have this different sign and symptoms na depende sa tissues na involved. Okay? Depende sa tissues na involved. Now, besides that, before that, let me discuss to you the vital signs changes. Okay? Vital signs. Asan ko i-add ang vital signs changes natin? Parang mahirap. Okay? Dito na lang sa baba. Vital sign changes in increase ICP. Ganun. Vital sign changes and increase ICP. And we call this the Cushing triad. Okay, Cushing's triad. Tandaan niyo yan, mga mi. Tandaan niyo yan. Cushing's triad. And Cushing's triad is just basically a reflex from ano? Cushing's triad is basically just a reflex. Reflex dahil nagkaroon tayo na tinatawag natin na cerebral hypoxia. So our brain or our body as a negative feedback mechanism signals our entire body to compensate for their cerebral hypoxia. And how does our body compensate? Through these vital signs changes, okay? Hypoxia. First one is our BP. Anong nangyayari sa BP natin? Okay, increase systolic blood pressure. Increase systolic blood pressure. Okay, increase systolic blood pressure because of increased cardiac contractility. Kasi sabi nga ng body natin, di ba? There's decrease. Maliit lang ang cerebral perfusion pressure natin. So we have to increase the cardiac contractility. Thereby, by increase mo cardiac contractility, more blood volume ang pupunta sa brain natin. Di ba? Positive feedback siya. Mas lalong magkakos ng di ba? Magkakos ng problem doon. Thereby, increasing cerebral tissue perfusion and oxygenation. Increase O2 and perfusion or increase CPP. Ayan. Increase systolic blood pressure. Okay? Increase systolic blood pressure. Now, our BP is normal. Okay? Our BP is normal or low. Or our diastolic BP rather. Ba't baliktad? Oh my God. Dyslexic error. Ganun. Dyslexic. Ayan. Our diastolic BP are usually ayan. Ayan. Normal or decrease. Bakit? There is longer time for heart to relax. Ayun. Long to relax. Ang heart natin, there's longer time to relax. Yan. I-check natin. systole natin, pa-increase, and ima-minus mo sa normal or decreased BP, di ba mas tataas ang ating pulse pressure? Kaya ang tawag sa ating vial sa Cushing's triad, isa sa Cushing's triad natin, sa BP, Cushing's triad natin is widen pulse pressure. Kasi nag-widen yung distance nila. Parang ganun lang yun. Widen pulse pressure. Ganon. Ganon. First one. First one. Our second one naman, ang ating pulse rate. Anong nangyayari sa pulse rate natin? Anong nangyayari sa pulse rate natin? Bradycardia. Ganun lang yan. Bradycardia or usually slow bounding pulse. Okay? Slow bounding pulse. And our RR, ang nangyayari sa ating patients with our RR is bradypnea. Bradypnea. Yan. Bradypnea. Bakit? Due to medulla. Sabi nga nun, di ba, medulla oblongata, responsible for our cardiorespiratory regulation, as well as our pons, pneumothoracic and apneistic center. Okay, pneumothoracic and apneistic center. Due to medulla and pons, ayan, nasira sila. Due to medulla and pons involvement. That's why ang ating Cushing triad, take note, is widened pulse pressure. Ayan, encircle natin. Widened pulse pressure, bradycardia, bradypnea. Tandaan nyo yun, ha? Tandaan nyo yun. Hyper, brady. Tandaan, brady. Kung sa hypovolemic shock, tachy. Dito naman sa Cushing's triad, increase ICP, brady. Okay? Brady. Okay, dito na tayo ulit. Increase pressure in the brain. When you increase the pressure of the brain, of course, affected ang mga, ang mga tissues natin doon. Okay? Ang mga tissues natin doon. And most importantly, especially if involved, ang brainstem natin kasi, di ba, important siya for our vitals, most especially sa medulla, kasi nandito yung autonomic function natin. Dito na-regulate yung autonomic function natin, ha? Autonomic function natin. Okay? Autonomic function. Okay? Our first one, okay, it differentiate. Ayan. First one is midbrain. Due to the compression of midbrain, sabi nga natin, nandito kanina yung reflexes natin, di ba? Midbrain, nandito yung reflexes natin. Due to compression of midbrain, nagde-decorticate ang ating pasyente. Pwedeng decorticate. And mas worse, ang decerebrate. Okay? Para matandaan nyo, mag-decorate ka muna bago mag-celebrate ng birthday mo. Decorticate and decerebrate. Okay? Decorticate and decerebrate. Again, decorticate before decerebrate. Decortication, flexion, adduction, internal rotation of upper extremities and extension of the lower extremities. Okay? Flexion, adduction, internal rotation of upper extremities. Take note of that, decorticate, flexion, adduction, internal rotation of upper extremities, and extension of lower extremities. Okay, decerebrate naman, extension, adduction, and internal rotation of upper extremities and extension of lower extremities. Again, take note, isulat natin, extension, adduction, and internal rotation of upper extremities and extension of the lower extremities. Okay? Lower extremities. Okay? And then our next one is our Dulce eye. Okay? Negative Dulce eye na siya. Negative Dulce eye or negative oculocephalic reflex. Negative oculocephalic reflex. Ganon. Negative oculocephalic reflex. Ganito lang yan. Di ba normally mga if magpapaside kayo ganyan, sinusunod niya kung ano nakikita mo, di ba? Sinusunod mo kung ano nakikita mo, papaside kayo yan. Kapag negative yan, kapag itaturn mo ang patient mo na may IICP na yan, susundin niya kung ano nasa gitna, parang ganyan. For example, ito pupil ko. Okay, ito pupil ko. Ganon. Ganun, sinusunod niya na lang. Negative Dulce eye. Dulce eye, di ba? Dulce eye, ganun. Parang Parang sinusunod niya. Ayun, ang nangyayari kasi negative oculocephalic reflex, sinusunod niya lang 'to. Sinusunod yung pupil niya nakasunod sa pag-turn ng head niya, gano'n. Yung pupil niya nandun lang, okey? Kaya negative, okey, negative, okey, negative, okey, negative. Gano'n, gano'n, basta gano'n, okey? Negative. Eyes are fixed in the midline, okey? Eyes are fixed in the midline. To put it in the mid and then the other one is negative as well for oculovestibular reflex. Tandaan niyo pa yung caloric testing natin sa special senses? Yung cows. Cow or C, nystagmus, 'di ba? Dislocate nystagmus of the eye due to response of cold or warm water, usually cold water daw. Kapag bibigay ka ng cold water sa ear natin nystagmus mo, ang nystagmus bibigay ka opposite, gano'n. Magpapa-side mo na ganyan, opposite, magni-nystagmus, okey. Papa-side water gano'n, slow, gano'n. Slow, gano'n, papa-side, basta opposite side. Now, kapag warm water naman, same side, okey. Pupunta sa side, slower yung eyes, do'n. Then magni-nystagmus sa dito na side, okey. Kapag warm, okey. Basically, para matandaan niyo 'yan, ang labo ko kausap, Diyos ko, ang labo ko kausap. Para matandaan niyo 'yan, para matandaan 'yan, ayan, C is for ano na nga 'yun, cold, opposite side. Cold, opposite, kunyari dito, then opposite side, warm, same side, warm, same side, okay, warm, same side. Oculovestibular reflex. Now, a great indication na nag-ICP yung patient natin ng poor prognosis is kapag negative na 'to. Okay, negative na yung response, okay? Imbes na ang cold dito, ang nystagmus siya, dito pupunta, okay? Opposite niya lang, okay? Dito pupunta, okay? Dito pupunta. And then sa warm naman, opposite na, opposite ulit. Naging opposite, naging cold, cold, same, cold, same, warm, opposite, naging kasawa na siya, naging kasawa na siya ang ating patient na may increase ICP, gano'n, naging kasawa, naging kasawa na ang ating patient na may increased ICP, okay, increased ICP, okay? And the next is our pons, and we know that our pons midbrain, 'di ba? Midbrain 'to. 'Di ba? Rhythm of respiration again, rhythm of respiration. Pons is our rhythm of respiration. Kaya ang nangyayari sa ating pasyente is Cheyne-Stokes respiration. Cheyne-Stokes respiration. Basically, ang nangyayari dito sa Cheyne-Stokes respiration, ganito 'to. Okay, ganito 'to. Alternate periods of waxing and waning of breathing, or pwede din normal na breathing with periods of apnea. For example, waning and waning. Tumataas then bumaba. Example nito, hinga yung patient natin, papaliit, then apnea. Hinga ulit yung patient natin, papalaki. Ayan. Parang ganun, basta ganun. Hinga, papalaki, then papaliit, then apnea. Hinga ulit yung patient natin, papalaki, waxing, then nag-wane, then apnea. Ganon. Ganon ang Cheyne-Stokes natin. Ganon. Very simple lang. Very simple. Ang dali-dali. Ang dali-dali. Cheyne-Stokes respiration. Okay? Cheyne-Stokes respiration. Ganon yan. And lastly, we have medulla oblongata. Okay, imagine yan. Imagine if affected yan and is responsible for cardiorespiratory regulation, cardiovascular and respiratory regulation, basically are autonomic and involuntary functions. This can cause projectile vomiting. Kasi 'di ba sabi natin kanina dito ang reflex center natin for vomiting, okay? Vomiting, dito din ang center natin for coughing, okay? Ano pa yung iba kanina? Vomiting, coughing, sneezing. Okay, so if nag-put ka ng pressure dyan, normally na vomiting lang, naging projectile na, ganon, may tatapon sa'yo, parang nagsha-shoot ng basketball, ganon. Okay? Nagsushoot ng basketball, okay? Nagsushoot ng basketball, nagsushoot ng projectile, vomit, gano'n, projectile vomit. And medullary depression or medullary compression can also cause respiratory depression. Ayan, kaya yun, matetegoks talaga ang pasyente natin. Kapag hindi treated properly ang ating ICP na patient. Ayun, yun yung ating signs and symptoms. Actually, sobrang dami pa. Kung basahin niyo yung book ni Ma'am Udan, ang dami-dami, ang dami-dami. So, sabi ko sa inyo, besides sa lecture nito, magbasa kayo ng other references such as Saunders and book ni Ma'am Udan para mas informed pa kayo informed pa kayo. Okay, okay. Meron din tayong tinatawag na herniation syndrome. Okay? Herniation